So I'm Dr. Kiran Shinde, and today we'll make a small video on trying to understand about the myths, the figures and facts about understanding anemia in pregnancy, or rather anemia in any woman. Anemia is a very common factor which is seen in almost the whole of the population of our country. The government has given a slogan of Anemia Mukta Bharat. That is because the government wants a situation where all the women and all the children who are born in this country would be healthy. Trying to understand what is anemia. Anemia is when the hemoglobin or the redness of the blood goes below a certain level. Suppose we take 10 gram percent as a low cutoff point. Anything below 10 is supposedly a case of anemia. Generally, we expect a level of more than 11. Anything more than 11, I would like to correct in my hospital. That is either by treatment, medicines, either food intake or some other way. Now, why is anemia so important? Anemia, basically, there are various causes of anemia. But if you look at the situation in our country, the commonest cause of anemia is nutritional anemia. That is, the patients are deficient, or there is a deficient intake or deficient absorption of certain elements in the body, which causes anemia. The commonest factor is iron. Second would be B12. Even folic acid or vitamin C can lead to anemia in various kinds and situations. So, if you look at the situation of iron, like iron is a common dietary material, but which is actually not taken in large quantities. So, what are the things if you look for iron-rich foods? That is to correction of anemia. So, if you look at iron-rich foods, the commonest thing are if you look at the vegetarian diet, dried beans, kidney beans, or maybe all kind of beans are good for you. Green leafy vegetables, especially spinach and other green leafy vegetables, are good for you. Dried fruits like raisins, apricots, prunes, they are good for you. Nuts and seeds, especially pumpkin seeds, cashew nuts, pistachios, hemp seeds, pine nuts and sunflower seeds are very good to raise the iron content in the body. For non-vegetarians, besides the vegetarian part, they can also indulge in having red meat, fish in the form of salmon, tuna, sardines, or even meat in the form of liver and other liver products. Eggs, especially the yellow part, the yolks, is a very good source of iron. For vitamin C, the other commonest foods which can be consumed are strawberries, watermelons, we have this amla, and also vitamin C rich vegetables. Besides this, there are certain foods which are fortified, like iron fortified cereals, breads, pastas, or enriched wheat products like whole wheat bread, enriched pasta and bran cereals. These are common things which can raise your iron content in the body. Commonest thing is black tea, which can also black tea is known to reduce iron absorption in the body. Black tea is good in a certain manner, but any tea consumed with sugar or with milk is supposedly not good for health. But a patient with anemia, black tea should not be consumed. So, how do we correct? One is the food habits, correction of the food habits. Number two is oral iron, or iron given in the form of medication. It can be given as injectable or injectables, or in the form of oral in the form of tablets or syrups. When we look at injectable, it is generally a single dose which is given to the patient, which is given IV. Along with that, the patient takes oral iron for a period of 9 months to complete the blood circulatory levels and also the liver stores of iron. Vitamin B12, generally found in non-vegetarian food, and the patients or the population need to consume vitamin B12 in some kind of supplements. Non-vegetarian eaters generally even they are deficient in vitamin B12. So even they need to be supplemented with some kind of oral tablets so that the vitamin B12 levels are maintained. So in general, anemia is a situation which needs to be corrected. Why? Because suppose a woman lands into a pregnancy with anemia, then obviously she is in a high risk category, because she is bound to have a child which could be a small IUGR child, a growth retarded child, some kind of deformities, or even there could be a problem with the fluid levels in the amniotic fluid levels. There are various presentations which can happen to the fetus. So there are complications which can happen to the mother, the complications can happen to the fetus. So anemia needs to be corrected, identified, diagnosed and corrected even before pregnancy, and even during pregnancy the same plan applies, and it is better that anemia is corrected as soon as it is recognized. this should be an enough discussion today on anemia. Any queries, we are open to queries, and it is very important that you consult a proper consultant, especially a gynecologist, to understand what is your situation about anemia. Thank you very much.